Hello, Yang. Hello, our lovely classmates. Welcome to my micro teaching homework about the GI tract chapter. And I picked a topic regarding to a test. It's very common in clinical work, and maybe I hope during our future work as interpreter, maybe we gonna have a chance to interpret for the patient of how to do this test. It's called H. pylori breathe test. So, first of all, let's talk about what exactly H. pylori and what is the H. pylori test. The H. pylori breathe test is a simple and very safe test. Briefly, the test is used to detect the H. pylori bacteria inside our body, inside our GI tract, and also the test can help the doctors to diagnose an active H. pylori infection. And thirdly, by taking this test, it is also for the healthcare providers to determine if the treatment has cured the infection. And also, maybe we can heard the test is called the urea breathe test because it's based on the urea volume. I'll explain it later. First of all, what is H. pylori? That's a bacteria's name, and the full name is called Helicobacter pylori, and in short form, which is easy to remember, it's H. pylori, is a bacteria that infects your stomach or the duodenum, the first part of the small intestine. And H. pylori can increase the risk of developing gastritis, the pelvic ulcer disease, and also the severe one, stomach cancer. The H. pylori is a major cause of peptic ulcer, and the bacteria can increase the stomach's protective mucus, so the layers can get sore or ulcer. So this makes the bacteria easier for the stomach to be damaged from digestive acids inside the intestine. So, and who can get the H. pylori infection? That's very common, actually. It's about 50% of the world's population is infected. However, most people are just a carrier and never have symptoms. So, and when should I get H. pylori breath test? So you can see your doctor or a healthcare provider if you have pain in your digestive system, digestive tract, like stomach ache or symptoms of a peptic ulcer, including you have burning pain in the middle of the stomach, middle of the upper stomach, between meals or at night. So when with an empty stomach, and pain that comes and goes if you eat something or you take an antacid, so anti-acid pills, and you may have some suffer from bloating, some heartburns, nausea and vomiting, and maybe eventually you will get some weight loss. So for the test, what will be happening during the H. pylori breathing test? During the test, you will be asked to exhale into a balloon-like bag. The amount of carbon dioxide you exhale into this bag is measured to provide a baseline level for the comparison with later another exhale. So next, you'll be asked to drink a small amount of actually it's a very pleasant taste. It's lemon flavored solution. The solution contains a substance called urea. So 15 minutes later, after drinking that solution, you will exhale into a second bag. The amount of carbon dioxide you exhale into the second bag is also measured. And H. pylori, if you carry that bacteria, it breaks down the urea in the solution you drank and releasing carbon dioxide in the breath you exhale. So if the amount of carbon dioxide in your second bag is higher than the amount in your first sample, which means the test result is positive. You are carrying that bacteria in your GI tract. And so how about the preparation? So maybe you're curious about the preparation. So what do I need to do before the procedure? So for the food and drink, you will be told, so 1 hour before the test, do not eat or drink anything, including water. That will affect the test results. And the procedure in total only lasts about 20 to 30 minutes, so which is quite simple and pretty straightforward. And after the procedure, your breath sample will be sent to the laboratory where they're tested, and you can eat or drink or exercise back to normal. You don't need to be fasting. You don't need to change your diet or anything. Nothing. So, and when should I expect the results after the procedure? Usually the results will take about, it depends how busy the laboratory in your local area is, and your health provider will contact you as soon as they receive the test results. And if it's positive, they will give you a prescription for antibiotics to take. And you'll be asked to follow a specific pattern of the how to take those pills. And after you finish that cycle, it's called a cycle, and usually 1 month later, the after the treatment, your doctor will order another test to compare whether the infection has been cured, be treated, or not. If you have a negative test, which is lucky, but you continue to have the symptoms, which means we can exclude the bacteria infection, and maybe you're going to be redirected to a different reason. The doctor will give you a different test to determine the cause of your symptoms. OK, so 下面我要讲一下就是中文普通话版本的。今天我想给大家讲的呢是关于消化系统的一项检查，它叫幽门螺旋杆菌的呼气实验。幽门螺旋杆菌这个呼气实验呢是一项非常简单、非常安全的一种测试。这个测试呢是主要用于检测这个幽门螺旋杆菌，它还可以诊断这个活动性的幽门螺旋杆菌的感染，也可以确定呢就是治疗之后这个感染是否痊愈了。而且这个测试因为它这个形式，它也被称为叫尿素呼气实验。首先我们想了解一下就是什么是幽门螺旋杆菌。幽门螺旋杆菌也被称为幽门螺杆菌，它是一种感染胃或者12指肠，也就是小肠的一部分的一个细菌。幽门螺旋杆菌呢会增加您患以下疾病的一些风险，比如说您可以患有胃炎呐，就是胃壁啊，胃的黏膜发炎或者受到刺激。还会患有这个消化性的溃疡，也就是胃溃疡，或者是小肠就12指肠的溃疡。甚至如果很长时间以后还会发生癌变，也就是患有胃癌，也和这个细菌的携带有关系。幽门螺旋杆菌呢，它是这个消化性溃疡的主要的一个罪魁祸首，一个主要的原因。这些细菌呢，它会减少胃的黏膜的保护性，使得这个胃壁这个胃的黏膜更容易受到这个酸液的侵蚀。那么谁会感染幽门螺旋杆菌呢？这个幽门螺旋杆菌的这个感染在社会中其实非常常见。世界上大约有1半左右的人，50%的人口是被感染的，但是大多数人从来没有出现过症状。那么比如说我还很关心我什么时候该进行这个幽门螺旋杆菌的呼气测试呢？如果就是说您出现消化道以下的症状，或者消化性溃疡的症状，比如说您2餐之间呢，就是胃相当于没有食物，或者胃比较空着 的一个状态的时候，或者晚上睡觉之前，就是觉得这个中部的胃部这个腹部的中上部感觉到一种烧痛或者灼痛的感觉。还有就是，如果您吃了点东西，或者吃一些抑酸的药，抑制胃酸的药，这个疼痛还是会时隐时现的。还有就是消化性的一些症状，比如说腹胀、胃部感觉有灼热感，或者是恶心，或者是呕吐。如果经历了这些情况以后，如果比如说患有癌症啊，或者说这些症状已经严重的影响到您的进食和生活，那么可能还会有体重的一些丢失或者减轻。在具体做测试的时候，会发生什么呢？这个测试本身还比较简单，不是很复杂的。在这个测试期间呢，您将被要求往这个气球状的一个袋子中呼气。首先呢，要测量一下您呼入该袋子中的这个二氧化碳的含量，然后这是一个提供的一个基线水平，然后用于和后面的这个含量做对比。接下来呢，您会被给到一个这个口味还比较好喝的一个柠檬味的溶液，这个溶液里面含有一种称为尿素的一个物质。喝完溶液大概15分钟以后，然后就请您呢将这个气呼到第二个袋子里面，这个第二个袋子里面的二氧化碳的含量也会是被测量的。它这个测试的原理就是说，如果幽门螺杆菌，如果您存在这个感染的话呢，它会分解您饮用的这个溶液中的尿素，并在您呼出的气体中产生二氧化碳。所以说，如果第二个样本中的二氧化碳含量要高于第一个样本中的相应的含量，这说明您这个检测结果就是阳性的，您就携带这个细菌在呼吸道里面。那么在这个检测之前，我需要做什么东西呢？您可能比较关心能不能吃东西，这个是您可以在正常的吃喝，早上起来如果是吃早餐都没问题的。但是检测时间的1小时以前是不要吃喝任何东西了，连水都不能够喝的。检测当天呢，医生和护士就会告诉您检测的具体步骤，然后大概这个检测会持续20到30分钟就会结束了。这个检测结束以后呢，您的呼吸样本将会被送到实验室进行检测测试，然后您也可以恢复正常的一些活动，正常的吃喝东西运动都没关系，没有任何的限制，也不需要卧床休息这些的。在做完检测之后，您可能会比较关心什么时候会有结果，这个可能要根据您具体的当地的一些实验室的一些时间表来看。但如果要是收到结果以后，医生发现您这个幽门螺杆菌是阳性的，他会给您开一些抗生素。这抗生素呢是必须按照一定的配比来服用的。医生开完一个疗程以后，一般来讲都会在帮你预约一个第2次的幽门螺杆菌呼气实验，然后用以判断这个呼吸道里面的幽门螺杆菌有没有清除干净。如果说您的检测结果是阴性的，但是您依然存在一些消化道的症状，您的这个家庭医生相当于就是通过这个测试排除了幽门螺杆菌感染造成的这些消化道症状，他应该会给您再预约一些其他的检查，并且确定这个产生症状的病因。